we've seen such a remarkable increase in anecdotal comments about racist public health practices, which on the one hand speaks to some important awareness of that history. Of course, a lot of it also isn't particularly accurate. So there's a tension there. Can you all just share some thoughts and offer maybe an example or two of historical realities that have really damaged our capacity to believe in those systems? While you mentioned some of this in some of your earlier comments, Dr. Keller, you've alluded to it. Dr. Mayer, you've really outlined it. Let's give our listeners just a little bit more of a concrete connection between historical injustices and where we are today, even if you have one or two examples. And for example, in looking at the history of African Americans overwhelmingly were a Southern population prior to what we refer to as the Great Migration, where healthcare options were extraordinarily limited. And so folks had to really rely on what they had learned along the way around healthcare that was very much homegrown. Some of that still works, some of it may not work. We have heard the Tuskegee experiment brought up in more ways than I had ever imagined it would be in these moments. So offer us just a little bit of some of those concrete historical connections so that maybe we can kind of begin to dispel some more of those myths, but certainly recognize where folks are coming from with their concerns. Anybody want to jump in on that? I know it's big. I know I just asked the toughest question.
Well, yeah. You put a word in there that was really difficult when you said dispel. That's a heavy lift.
No pressure. Just fix that for us, brother.
Yeah. Clear communication and critical thinking. If we can get one or the other, that'll help. If we have neither, we have big problems. And we didn't have clear communication from the federal government for sure. And then, it degenerated from there, in my view, the quality of it. And then in terms of critical thinking. So I don't know if it was Jesse Jackson that coined this phrase or not, but that's who I attribute it to. He said, just because I'm paranoid doesn't mean nobody's following me. And my point is that there's absolute, irrefutable, undeniable reason to be wary and to raise an eyebrow at systems. I don't even think that we need to qualify that, whether it's from Native American, Hispanic, Latino, Black, Asian, poor white, to be wary. But at the same time, so Tuskegee is a good example because there's nuance. So there was a thing called the Tuskegee experiment sometime in the 1930s-ish. I'm going to be slightly imprecise. But that was one of the things that was lifted up as why we can't do it, because we were infected with syphilis back then. And so whoever says that has gone too far. They got a piece of information. Yes, there was something bad that happened by way of the government. One, so that's the truth, but it was not an infecting that took place. It was people that the government pretended they were treating and did not. It was a withholding of treatment. So it was bad information. And so on the one hand, don't trust the government or double check or be a critical thinker with your information because this happened. But then on the other hand, don't do the same thing that offends you or offends us and be inaccurate with our passing on of information. They infected Black men with syphilis. That's not accurate. And so that's that critical thinking part. And it's tough. I can mostly speak for the Black community because that's where I come from. We love a good conspiracy. And if we have to dig a little bit, but not a lot to find it, that's even better. But if we're offended by inaccurate information from others, from the government, then let us not commit the same offense by passing on inaccurate information. And I think that just happened too often and too easily. And of course, social media and all its distribution channels, it's tough to beat all that information flying all over the place, memes, articles, experts. It's just tough.
A lot of noise on the frequency, a lot of static on the frequency.
Yeah, and then unclear. And then if you don't have a person or persons, certainly a federal government and president, that you can be confident, reasonably confident in the information, then it's a free for all. And that's where we found ourselves.
Yeah, thanks.
Yeah.
Anybody else want to jump in with any examples? Go ahead, Dr.
Yeah,
Hill.
I'm happy to. So, again, speaking from, the African Americans in the history with science, for me as a vaccine, when we were in the testing phase and the vaccine was being developed, there was a lot of, in addition to talking about the Tuskegee study, a lot of references to the life of Henrietta Lacks and her story. And for those of you joining us who don't know, Henrietta was an African-American woman who had gone to Johns Hopkins for treatment for, I believe it was cervical cancer. And during the course of her treatment, without her consent or knowledge, parts of her cells were taken and kept, and ultimately became what we now know as HeLa cells. And, so this was, I'm going to be inaccurate too, 1950, early 50s. And she ultimately passed away from her cervical cancer, but her family had no knowledge that her cells had been taken, or that essentially, we think of her as like the mother of modern science, because her cells were able to live past her. And a lot of the information that we have in modern technology and within science, a lot of people can draw on the work that was done on HeLa cells. And so again, this idea of, experimentation without consent and what happens to this kind of also clouded the conversations about, the vaccine, its safety, its efficacy, how was it developed? And then also, it was developed so quickly, but actually, not paying attention or not really understanding that research had been worked on since the technology behind the vaccine. Researchers have been working on that since the 80s to actually have it ready to go. And, the amount of effort, if you look at manpower and man hours, there was little research being done in healthcare during the time that the vaccine was done that was not on that vaccine. So, that's what would normally have taken years was just condensed in the amount of manpower that it took to develop that. But as we think about, we actually had, I believe it was a granddaughter of Henrietta Lacks in Milwaukee talking about her grandmother's experience, her family's experience, and yet still saying that vaccination was important. Her family supported medical research despite their very complicated history with this, that this was what was right. And so again, I think people were very, inclined to believe that the negative of it. But even when someone who I would say has every right to have, to feel some kind of way about medical technology, they were very publicly advocating for communities of color to get vaccinated. So I think that's and that's part of the struggle, right? Is that we can't, Henrietta Lacks, Tuskegee, but before that, the African American history with slavery and lynching. And we can even talk about, while COVID was happening, we were also going through the Black Lives Matter. And that's another insult on African Americans. And so, I'm going to let Dr. Mayer talk about our Native populations, but, would love to revisit that in terms of how did we get to this kind of the overlap of the COVID-19 pandemic and Black Lives Matter and what that meant for communities of color.
Yeah, and Dr. Mayer, as you get your thoughts tuned up, it's really interesting that number one, we have to acknowledge that researchers, which means places like Marquette, universities, are institutions that people have come to distrust as a result. So we've got our own set of responsibilities that are ongoing. This is not something that goes away. It's not like one day we're going to be trusted. This is an ongoing process. And yet, anytime I visit a medical facility, medical technology is remarkable, you know? And so if I have my phone in my hand and I believe in that technology, I'm going to also believe in medical technology too, because we see what it does on a regular basis. That's not to say we don't have those concerns, because you all are absolutely correct. Those historical injustices inform so much of our challenges today. But boy, medical technology is literally saving lives every single moment of our day. Dr. Mayer, go ahead and jump in if you want to add some more.
Yeah, I'll try and wrap in both here, a little bit of the history, just to touch on a couple things for the Native community, but then also to speak to the vaccine and the way these technologies are developed, and then the question of our institutions. Just a couple thoughts. First, when again connecting with these histories that we sometimes know about, that our communities maybe know about best, and we don't get fully educated. When I think about sort of our educational system and how we talk about race and our histories, the history of white supremacy in the country, and naming these things, there are certainly many instances we could point to in the Native community regarding these connections that don't get taught. So for instance, the biggest one that comes to mind for me is the investigation done in 1976 on the sterilization of Native women through Indian Health Services. When Congress was alerted to the idea that Native women were being sterilized without their knowledge and against their wishes. Okay, so a woman would go in, perhaps she would be having a baby, she would have that baby and then wouldn't realize or know until later that within that, procedure, she had been sterilized and then couldn't have more children. When Congress investigated, I think it was through like 1973 through 1976. They did not go further back, and they said, yep, this happened, but didn't fully investigate. So to this day, we don't know how extensive that was. There were these kinds of sterilizations going on with Native women just in Canada a few years ago. I think 2016 or 2017, those reports came out. And so, as with the African American community, the Native community also has these specific instances, but then also the broader history. When we think of Native people and this connection to disease and being sort of statistically categorized as more likely to have diabetes, more likely to you can just kind of run down the numbers there, and in this case, COVID as well, COVID deaths. I think, the connections we need to make with that aren't always made when we simplify things. If we go back and look at, for instance, the 1918-1919 flu epidemic and how that disproportionately affected, as far as the rates go, population rates, Native people. You have a people who had been through huge displacements, removal from homelands, put onto reservations, lots of starvation and malnutrition. These things, we know now, trauma. All these factors are a recipe for someone to be more susceptible to disease. And yet at that time particularly, and I think sometimes even now we fall into reading these things this way, it would have been, Native people are especially vulnerable to disease. Okay, and that we really need to caution against. It really is these socio-historical political factors and these key pieces of access of information that affect our population. So with that, I just want to say, coming to, some of these, the mistrust, the conspiracy theories, someone coming from the humanities, I'm looking at this as, what are the stories we're telling? Where are we telling these stories? We are now engaged in social media where anybody can come on and suggest anything. And we have this sort of dispersal of authority. We have folks in authority who, we mistrust, and that's a recipe too. I would also say that, we can talk about health disparities, but we need to talk about the links, the disparities in education. As someone who every day teaches students how to do research, how to assess a source, even within my family and friends, I found myself saying, okay, you're sending me this article that says vaccines are dangerous. And when I'm looking at it, I'm seeing how it's not sourced well. We need a population who knows how to read these things and do that critical thinking piece. And I have to say, I think, this is an education piece as much as it is a healthcare piece.